now we are coming with the necrotizing fasciitis. As I was telling, the type 1 and type 2. Type 1 is mostly associated with this diabetic type 1, and also we are having peripheral vascular disease, and it is going with gram positive, gram negative, and anaerobe. And even after chicken pox, we had some question that the patient was having chicken pox. Because of that chicken pox, there will be scar. There is an opening in your skin. So with that hole, the bacteria can enter inside and can cause this necrotizing fasciitis type 1. Okay. And how you will know this necrotizing fasciitis? And type 2 is caused by Streptococcus pyogenes. This is a single one. Okay, this is not a mixed one. This is this was also in a question. So every single line of Margravia is actually important. So type 2 is caused by group A, beta hemolyticus Streptococcus pyogenes. This one, as we have done, right? This is the group A. I mean, this is the beta hemolytic, the full hemolysis, and group A condition. Okay, so this is the type 1 and type 2. And how you will diagnose this? How will be the picture come? The picture will be that there is the redness in the skin with painful lesion, and the pain is out of proportion of that lesion. I mean, maybe if maybe the wound is like this, but I mean, this is the thigh maybe, okay? This is the joint, I mean, knee joint. I wanted to just mark it. Okay, so if the lesion is this much only, the redness and edematous, everything is here, the pain would be out of proportion. Maybe the whole thigh would be painful. Okay, so it is out of that your lesion. When it is like that, in that time you would think of this necrotizing fasciitis. Okay, so it's an surgical emergency. So what's your treatment? Your treatment protocol should be, first you will call the surgery department for surgical debridement, surgery referral. Okay, then IV antibiotic. So you can get the both options together, this surgery and IV antibiotic. Choose first this surgical referral first. Okay, then you will go for IV antibiotic. Here also IV, because this is a like emergency case, so better with IV. Okay. So
I want to add this. There are three questions that keeps on repeating with necrotizing fasciitis. Either it's a diagnosis and very vague kind of a picture, and you will either thinking about toxic gangrene. There was one question which was very close to gangrene, and either you were thinking about necrotizing fasciitis, and then there is another cellulitis, and the fourth one is toxic shock syndrome. There was a picture that looked like toxic shock syndrome, but the answer was necrotizing fasciitis. Second thing, they will ask about the first or urgent management, and third will the which antibiotics to use. These three questions keep on repeating with different scenarios
yeah.
for this
So
necrotizing.
because we say it's a Streptococcus pyogenes, it's more easy to remember it's benpen. If not, then and add the clindamycin. Because just like for staph, we remember it's your fluclox. So for Streptococcus, we know it's benpen.
Yes. Pangent penicillin. Benpen. So here, what is the most appropriate treatment? First one is surgical debridement. Okay, surgical referral is important. So this is the most important thing. So now come with our anthrax. This is by Bacillus anthrax. This is our B from ABCDL, right? So we finish our Staphylo and Strepto everything. Now we are coming with our anthrax, ABCDL, that gram-positive rot. So this is our B, Bacillus anthrax. So anthrax, how it will cause? Usually whoever working in a farm, like animal farm, they're working with the dead bodies of the animals, they can have this anthrax. And also this is sometimes it is entered through from wool sorters, means who are working with wool, that this bacteria can enter through the lungs, and it can happen with pulmonary anthrax. That one is wool sorters disease. So it is also calling wool sorter disease. It will cause in the pulmonary anthrax. Okay. So Bacillus anthrax, you will get, usually we having the important thing is this painless eschar. Okay. This painless eschar is more important, and this black eschar you will get in also another thing, if you remember scrub typhus. Okay, but of course the scenario will be different. So if you get the word black eschar in your question, try to think of this anthrax or try to think of our scrub typhus. If it is painless, and if you are thinking this is like a maybe veterinarian or maybe wool sorters or working with animals, animal farms, then with painless black scar, you will think of anthrax first. And if there is any prodromal phase, like we know, no, in typhus, there will be a prodromal phase with cough, muscle pain, and it could be GIT upset. And with that, if a scar is there, that one is scrub typhus. So just let's have a quick look to our scar. This scar is totally black. See, it's totally black.
You can't see the screen.
Okay, again, the problem. I think I have to share my whole desktop. Can you see?
Susan, I've asked you a question. See the
Mhm.
messages.
Okay.
Where it is? You can see now, no? Right?
Yes, we.
This one is the scar, okay? Like it is black and it will be painless. So if it is painless, think about it, this our anthrax. But even this scrub, it can be with pain, and there will be some prodromal phase, there will be tick bite, like that.